Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by HealthQuest Radio with Dr. David Kolbaba. Every Saturday morning at 11, right here on AM 560, The Answer.
If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Good morning, Dan and Amy. Andrew Cuomo.
America's governor.
America's governor, that's what I understand. Future speaker at day one of the DNC. Andrew Cuomo back at the height of the infections in New York City and New York State. This was that governor, Andrew Cuomo.
Government facilitates people's actions, right? We had to double the hospital capacity in New York State. That's what all the experts said. President brought in the Army Corps of Engineers. They built 2,500 beds at Javits that Michael and Northwell were operating. It was a phenomenal accomplishment. Close to 1,000 people have gone through Javits. Luckily, we didn't need the 2,500 beds, but all the projections said we did need it, and more, by the way. So these were just extraordinary efforts and acts of mobilization. And the federal government stepped up and was a great partner. And I'm the first one to say it. We needed help, and they were there. State and local governments were fantastic. The hospital system was fantastic. New Yorkers were fantastic. And that is an undeniable fact. Just to look at what they said was going to happen. CDC, Coronavirus Task Force, Cornell, McKinsey, all of them. And they had a line up here, and the actual line is down here. What do you owe the variance to? Heroic efforts on behalf of people as facilitated by government, federal and state.
Really? Remember that, Andrew Cuomo? Because you got the other governor, Andrew Cuomo, on Monday evening, didn't you?
Our collective strength is exercised through government. It is, in effect, our immune system. And our current federal government is dysfunctional and incompetent. It couldn't fight off the virus. In fact, it didn't even see it coming. The European virus infected the Northeast while the White House was still fixated on China. The virus had been attacking us for months before they even knew it was here. We saw the failure of a government that tried to deny the virus, then tried to ignore it, and then tried to politicize it. The failed federal government that watched New York get ambushed by their negligence and then watched New York suffer, but all through it learned absolutely nothing.
Boy, those are about 180 degrees apart and just a couple of months apart, aren't they? So I'm sorry, who's politicizing the virus? Andrew Cuomo also getting hit from The Atlantic, of all places, hardly a conservative outlet. No, COVID-19 is not a metaphor, as you tried to use it as a metaphor for our politics. Cuomo may have a good story to tell about New York's stabilization and recovery, but can a finally flattened curve really count as a success when the initial spike was so severe, so deadly, and so preventable? The governor would say yes. He routinely deflected questions about what he could have done differently and skirted blame for New York's nursing home tragedy, which by some estimates was 6,000 excess deaths because of his decision to send infected patients back into nursing homes. And there's no accounting for that. So tell me again where the buck has stopped and where it hasn't, who's politicizing and who isn't, who's maintaining a consistent message and a consistent posture of assistance, and who is lauding those who provide resources when they do, and then turning right around and sticking it in their back when it becomes politically expedient to do so. And that's America's governor? No, I don't think so. For more on this and a few other topics, we're pleased to be joined again by the United States Surgeon General. He is Dr. Jerome Adams. Dr. Adams, thanks for joining us. Appreciate it.
Absolutely. Glad to be with you this morning, and I wish I was in person because the weather's not so nice here in D.C. as it is in Chicago, at least from your weather report.
Yeah.
Well, Dr. Adams, I feel like you're here with us because your billboards are up all over Chicago.
I have heard that, and if people haven't seen those, then I want to remind them that if you've recovered from COVID-19, you can save a life by donating your plasma. That's what those billboards are about right now, and we'll be shifting into other messaging about the things people can do to keep themselves and their city safe. My 3 W's: wash your hands, watch your distance, meaning stay 6 feet from others and avoid crowded indoor spaces, and wear a mask. And if we do those 3 things, we can stay open. I've heard in Chicago recently they've had to close down some restaurants because people aren't abiding by some of the basic public health measures that will allow us to be able to stay open. So,
well, that and looting and people not wanting to come downtown.
No. They haven't had to close. What they've done is they've chosen to close because of exactly what we were just talking about before you came on, which is the rank politicization of this and the power grabs that are being made by politicians. And I know this is not your space. You're a medical professional and you're focused on that aspect of this. But I mean, unfortunately, you have to deal with it and deal with it all, as does every member of the task force, every member of the president's team on this. And I just wonder how you receive people who, on the one hand, say, "Thank you so much, Dr. Adams," and in the next breath they say, "Dr. Adams is part of the problem," like Andrew Cuomo.
Well, I tell you, it's been incredibly frustrating all around. We're dealing with a once-in-a-century pandemic, and everyone acknowledges that we haven't seen or experienced anything like this from a public health perspective. But there's no chapter in the pandemic playbook on an impeachment trial or a presidential election or a social justice movement, the likes of which we haven't seen since the 60s. And it changes everyone's motives, everyone's agendas, and the way people act. I mean, unfortunately, there are people who hate the other party on both sides more than they hate the virus. And I'm here just trying to defeat the virus. And you mentioned Governor Cuomo. I think we all have to be careful, again, no matter which side you're on, about taking a victory lap when you've got 170,000 people dead. We have got to be careful about pointing fingers. We've got red state governors who've had problems. We have California and New York, the 2 states that are responsible for the most cases and the most deaths in the entire country. And so there's no one who's come out of this unscathed. We've all been humbled, but we all will get through this together and by trying to take the politics out of it.
Yeah, well said. Something else that's a problem, too, is I would argue, willful promulgation of misinformation that drives ignorance, that drives fear. And I speak to a new survey from Franklin Templeton and Gallup that finds Americans completely misinformed about the virus and its impact. For example, Americans believe that people age 55 and older account for just over half of the total COVID-19 deaths. The actual figure is 92%. Americans believe that people 44 and younger account for about 30% of total deaths. The actual figure is 2.7%, off by a factor of 15. Americans overestimate the risk of death from COVID-19 for people aged 24 and younger by a factor of 50, and they think the risk for people aged 65 and older is half what it actually is. So they have it exactly reversed because they have perpetuated this misinformation that everybody has equal exposure, so they apply too much risk at the younger ages when we're talking about, for example, reopening schools, and they apply a too little risk at the older ages for the people that we should be most concerned about protecting. That's a problem.
Well, you're right, Dan. I mean, you're so right, and unfortunately, again, you've got politics and you've got people whose agenda really is other things than informing the public. And you've got people who've really overplayed concerns in some sectors and underplayed concerns in other sectors. And they also present these binary options, all or none. They say if you're for reopening, then you have to be against health. And what I say to people is, look, whether or not you will be able to safely reopen depends on the background community transmission rates. And so it's not health or reopening. It is, let's follow some basic public health measures that are small inconveniences so that we can have the bigger conveniences of reopening and staying open. That's what I really hope people will come together and understand. And I also would tell people to go to coronavirus.gov, available in English and Spanish, or to the State Department of Health website, and look at the facts yourself. Look at the statistics yourself. Don't believe the spin on whichever TV channel you choose to watch, because in most cases it is just that, spin. It's not really designed to give you information so much as it is to push an agenda.
Well, after the Spanish flu or Army flu, whatever, they at 6 months after that, people went back to school and they lived their lives. Why aren't we doing that here?
Well,
because that was a much more lethal disease here. I mean, we're testing people who don't even know that they have this quote unquote deadly disease or virus.
Well, you're correct. We know that in many cases, in some situations, particularly in younger age groups, over 50% of people can spread this disease without ever having symptoms. Dan, you brought up a great point that the risk of complications is lower, and I do want to say low risk does not mean no risk, but is lower in young people than in older people. And one of our strategies has really been to try to protect the vulnerable, particularly those in nursing homes, who accounted for 40% of the deaths early on in this pandemic. And we're doing a much better job of that, and we know that because fewer people are dying after being diagnosed with the disease, and people are getting out of the hospital sooner, and part of that's because it's younger people getting it. But what I want people to understand is that we don't have to choose between one or the other. What we want young people to understand when they go back to school is the virus is still going to virus. So we still want you to just as during flu season, we want you to wash your hands. We want you to stay away from people who may be sick. And in this case, you can't tell from looking at someone whether they're sick, which is why we say practice social distancing. But you can still go out in public. You can still go to a restaurant. You can still go back to school if you follow these basic precautions. If you don't, the virus will spread, and it will take control of our lives. And that's what I don't want to happen.
Let's talk about vaccines for a minute. There's a good piece, an op-ed from Dr. Joel Zinberg, who's at the Competitive Enterprise Institute. He is also a clinical professor of surgery at Mount Sinai in New York, and a University of Chicago professor of public policy, Tomas Philipson, about Operation Warp Speed. And by the way, and I wish perhaps somebody would have leveled this up for public consumption a little bit earlier, they talk about their work in developing a plan in September of last year. White House report managing the impact of pandemic influenza through vaccine innovation, which prompted immediate presidential action, an executive order issued by Trump, that has accelerated development of a COVID vaccine. The main issue previously is vaccine developers aren't rewarded for innovation to overcome the problem of underinvestment. They proposed in this report public investment in public-private research and development partnerships to promote push incentives rather than just the pull incentives previously. And through Operation Warp Speed, the government assumes the economic risk of establishing mass production capabilities while vaccines are still in development, rather than waiting until after approval to scale up production. And resources have been devoted to this, as well as to therapeutics like those produced by Regeneron Pharmaceuticals. And so this is something that shows some foresight and action before we recognized that COVID-19 was going to dominate us in 2020. It seems to me something that should be discussed a little bit more openly by the administration.
Well, you're so right. And you don't want to take a victory lap. You don't want to call 170,000 people dead a success. But one of the things that has come out of this has been incredibly positive has been the public-private partnerships towards therapeutic and vaccine developments, a record pace, and it really is going to change the way we develop these types of products moving forward in the future. So it will not only help us overcome this pandemic, but it will help us with other pandemics. Remdesivir, steroids, convalescent plasma therapeutics really have decreased, again, the mortality rate. And we're going to have a vaccine. Tony Fauci tells me he still expects a vaccine by the end of this year, beginning of next year. And that's important for people to understand, because when people say, how long do we have to follow these basic public health measures? Is it going to be forever? No, it's literally going to be through the end of this year, beginning of next year. We're trying to limit the loss of life and spread until we get to a vaccine. And because of Operation Warp Speed, we're going to get to a vaccine faster than anyone ever predicted. And again, in time, for us to be able to significantly lower loss of life, but it doesn't mean we have to shut down. We can stay open if people would just use common sense. Stay safe.
Well, we've been using common sense. I mean, this is getting old. I'm sorry. I'm very frustrated, but the school's
Me too.
not. Well, no, we're killing our children. Do you understand? I mean, we can't go back for in-person learning here in Chicago, and the juniors and seniors are never going back. And I just, because the vaccine will make this all better. Is that what you're saying?
Well, what I'm saying is, and I do want you to know that I have a 16, a 14, and a 10-year-old. So this isn't just something that I'm preaching. This is something I'm living. We know that children who are out of school are more likely to be obese, misuse substances. There are 4.2 million children behind on vaccinations. In Massachusetts, they did a study where they showed child abuse reporting was down 50% coincident with COVID because a lot of that occurs in school. So there are real health harms, both emotionally, mentally, and also physically for kids being out of school. Our default position should be kids should be in school. Here's the challenge. The best school opening plan in the world will fail if you have runaway community transmission. And the worst school opening plan in the world will be a success if you decrease the background community transmission rates. And we know we can do it. Italy, Spain, hardest hit in the world, are reopening schools, sports, tourism again. And they're doing it, again, by following the basic public health measures that have become politicized. Wearing a face mask is an inconvenience. I've worn one most of my life as an anesthesiologist, but it is a small inconvenience compared to being able to send my kids to school or be able to go to church on Sunday or to be able to go and see the Bears play, on Sunday. And so I'm just asking people, follow these basic measures so we can lower the community transmission rates and we can open, and don't get sucked into this all or none, one or the other. It's either reopening or it's health. The way to reopening is through health.
What about this matter of antibodies and the expression of antibodies in the population? There's been some interesting data comparisons that I've looked at. We talked about on the show a little bit yesterday, where you find that New York and Sweden had decreased their deaths to near zero at about the same time, and they reached antibody expression in the population about the same level of 15 to 20%. You also see this in northern Italy. You see this in a hotspot in Iran. That perhaps herd immunity is much lower than some of the experts actually thought, and that the one variable that actually matters is not shutdowns, it's not even mask wearing, it's the level of antibody expression in the population that's suffered an outbreak.
Well, I would direct people to the New York Times article on this. It actually does a really good job of describing B-cell immunity and T-cell immunity. And when we look at antibodies, that's your body's response to the virus when it's in its system. And we can measure antibodies really easily. But there's also T-cell immunity, which is really hard to measure. And there's some belief that people may have T-cell immunity from getting other coronaviruses, and the common cold is a coronavirus that we've all been exposed to, and that may lessen the number of people who need to actually be infected to get to a level of what you call herd immunity, which is where the disease can't spread successfully in a community because enough people are immune. We're hopeful for that, but the important policy point is that people who argue herd immunity then say, well, we need to let the virus rip so we get to herd immunity. I actually reject that. I think that you can hope for herd immunity while also taking public health measures, because if you take those public health measures, you decrease the R0 and the transmissibility in the community. These two should work together. It should be herd immunity plus public health measures so that fewer people die and you actually have less transmission of disease. It's not one versus the other. It is both. And again, we're still investigating and hoping that we really do see that we can get to herd immunity at lower levels and break transmission. Remember New York, and you started off with Andrew Cuomo. If you assume that they did get there by getting to herd immunity, you also have to look at the fact that they got there by losing 60,000 plus people in their state. And that's a price that we don't have to pay to get the herd immunity. We can be smarter about achieving it in other places. And again, that's by using the public health measures and hoping that we can get to herd immunity. And a vaccine will also add to herd immunity, which again we'll have hopefully by December or maybe as early as November.
He is Dr. Jerome Adams. He's the Surgeon General of the United States. Dr. Adams, thanks again for joining us. Appreciate it.
Hey, thank you. 3 W's, wash your hands, wear a mask, watch your distance, and we will get through this. Don't let people suck you into the politics, because it really should be about public health and all of us coming together. I have faith we can do it, and I want to thank you all for giving people the facts, coronavirus.gov.
Thanks for joining us again, Doctor. Appreciate your time.
And he joined us on our turnkey.pro answer line. Coming up on Chicago's Morning Answer.
We will turn our attention to the compact between Israel and UAE when Israel's Consul General to the Midwest, Aviv Ezra, joins us at 7:07.
And later, is it rude to ask someone who they are voting for? We'll explain. But now let's head into the newsroom. Here is Mike Scott.
Replacing those lead water pipes. White Sox rough up the Tigers, and the Bears are missing a cornerback. WIND Chicago News Time, 7 o'clock.
Democrats formally nominate Joe Biden for president. I'm Dave Anthony, Fox News.
It means the world to me and my family, and I'll see you on Thursday. Thank you, thank you, thank you.
And Joe Biden's wife, Jill, was there with him last night as well.
If we entrust this nation to Joe, he will do for your family